Welcome then to this webinar on CINAHL, the Advanced Searching on the Native EBSCO Search Interface. So I'm Richard Crooks, Senior Manager for Training Services for the UK and Ireland, and in this 45-minute webinar, I will introduce you to the advanced search concepts on CINAHL, the most widely used and respected research tool for nurses, students, and health professionals. And in this session, we'll look at subject headings or subject searching, combining keywords and subject searches, using the search history, saving our results for future access, and also setting up search and publication alerts. So this kind of follows on from the previous session, the basic session, which you may have attended. If not, that's fine. You may be at the level where you look at more some advanced search features. However, I will also add in this session, we're not going to cover the wildcards directly or the proximity searching. That's something that we leave for our session on supporting systematic reviews on CINAHL Medline. So again, if you want to know more in depth information about using those particular features, then I recommend signing up for one of the other sessions as well, okay, if you've not already done so previously. So we'll look at particular aspects or features here for this webinar. In terms of housekeeping, just a reminder, please forward any comments or questions in the WebEx chat available on the right side of your screen. If you cannot see it, it may have collapsed as a floating toolbar across the top of the screen, so by all means enable that and forward comments or questions through as we go through this session. I don't have the luxury of an assistant to monitor that chat, although one of my colleagues has often volunteered to do this for me, but he's also very busy. So what I would suggest is that I will try and get to you as soon as I can. I keep my eye open on the chat panel and respond to you as soon as I can. Failing that, I'll endeavor to follow up with you after the session has concluded, okay? But by all means, send them through as questions arise, or maybe you have something in your own experience of using the EBSCO interface that you'd like to share or comment on, etc. So feel free to do that. In terms of the audio, hopefully you're connected now and hear me loud and clear. If you have any issues with the audio during the course of the webinar, then please go to the audio link on the top toolbar. And then if you go to audio conference, you should be able to check your settings there. You can also test your speaker or microphone as needed. Okay, so thanks for your cooperation with that. Okay, in terms of the actual session itself, finally, by the end of the session, you'll be able to use CINAHL Subject Headings to find authoritative search results. Again, this is a step on. We're not just going to do keyword searching. In fact, we're going to combine keyword searching with the subject headings that are available for CINAHL. We'll look at saving results and searches using the EBSCO folder, so signing in, and then with that, you can create custom folders and share content with other users. You also can create search and journal alerts, so we'll look at that today, so that you can keep current with the literature that's out there rather than having to keep going back and retrieving your search and then running it manually, as it were. And then finally, we'll look at finding further help and support information on CINAHL databases, and I'll include links to some key tutorials and help sheets at the end of this PowerPoint as well, so you'll have that to follow up in your own time. But we'll look at that live just briefly toward the end of the session, time permitting, and also allow some time for any final questions or comments. So I hope that's what you're expecting from today's session. As I said, there are other sessions out there, and I'll remind you of those as we close this morning. Okay, so we will go now to the live demo. So we'll shortly be switching screens to take you to CINAHL. So let me just do that right now. Okay, and by all means, do let me know if at some point I forget to share my screen. Or if I go too quickly, do let me know and I'll slow down. Okay, so we come to CINAHL. This again may look familiar to you based on the previous session and also your ongoing use of this within the NHS, or if you're in Ireland, you may be using another version of CINAHL, like CINAHL Complete, or in Wales, you have now CINAHL Plus Full Text. So again, whichever version of CINAHL, the principles that we're looking at today will be applicable. Okay. So the first we're going to do is look at our initial keyword search, but with a different take on it this time. So basically what we can do here is run our search. So we look at GERD or GORD. So you can see here we've got the autocomplete feature popping out, which gives us additional terms that we can include. So we can include these, okay? We can just customize this a bit as well, add our own terms here, or GORD. I like to keep the operators in uppercase. It doesn't have to be. It depends on how you have the setup in EBSCO bin, because you can specify that operators like and or not should be uppercase. but I'm going to do that as a rule of thumb here. And I'm also going to include heartburn here too. Okay, so you can add your terms here. Okay, so multiple terms. Okay, I'll just make this more consistent here. So right now we're just creating the first query, which is the free text or keyword searching. And if you recall from the first basic session, the unqualified keyword searching on CINAHL will search through the title fields, the abstract field, and also perform a word search of the index as well. So that's not an exact phrase searching, that's just a word search of the term in the index. So we will look at exact phrase searching in a moment. So we've got our terms here, okay, and what we can do is select this option, suggest subject terms. So if I click search now, you'll see what it does is bring up the appropriate heading for this term. Okay, so obviously we're looking at gastroesophageal reflux, which if you are looking for that, then you should choose this term. Okay, so this is the heading that we're looking for primarily. But what we can also do in this instance, we can also combine with our original keyword search, and you can see that below, highlighted in pink. So one step in a sense, you just select these two options. We can combine the two terms. If you look to the far right, you'll see them grouped together in the box under search database. So we have our index search and we have our free text keyword search, and they're combined using the OR operator. So in other words, we'll find any item where these terms appear in the title or abstract, etc., combined with any item that's been indexed with gastroesophageal reflux. So making use of the CINAHL Subject Headings, the control vocabulary for this database. Now there are, as you can see, other options as well. So if you choose the index term, as I've done with gastroesophageal reflux, you'll see the three columns here. The explode column, which is represented by the plus sign, is grayed out because there are no narrow terms for this term. So whenever you see the box grayed out, there are no narrow terms. You'll see the major concept option is selectable. So basically what that would mean, if we were to select that, then we would be focusing primarily on that topic for any article indexed to that term. So of course it may be another condition that a patient or population suffers with, but then maybe the focus may be on a particular intervention or treatment for some other condition. So again, major concept means that it will be the primary focus. However, we're going to keep it quite broad before narrowing. And then we've got the scope note. So the scope note will just give you that definition of the term itself. There are the subheadings again. So there's a list of subheadings that you can also call upon. So if you're going to focus on diet therapy for this condition, then you can select that option. You'll see the scope note here specifically for this. There it is. And you'll see when you choose a subheading, it appends the code there, DH, at the end of the term. However, again, we're going to keep it quite broad to begin with, but just to indicate that you can obviously focus your search in terms of the actual index term. So again, all these subheadings relate to the indexing for this term. Just to add, if you scroll down, you'll also see related headings as well. So you might want to add heartburn. So if we wanted to add heartburn as an index term, we can do that here by going to Browse Additional Terms, and then we can, again, we can just clear this, search for heartburn here specifically, okay, and we can include that as well, okay. And now you'll see it's included. So we've got two index terms plus the keyword search combined with OR, and then we can run this. So once we do, that pops up in the search history above the result list. As you can see the search string there. And then, of course, the second element is the actual intervention that we're looking at, which will be the use of PPIs or proton pump inhibitors. So we can follow the same procedure. We can add our terms. You can set up the drop-down or carry on typing. Okay. And then we can run a search on these terms, okay, and just, again, select suggest subject terms, click search, and then this brings up the preferred heading. So for CINAHL, the indexers use this term to identify any content about PPIs, etc. And this time, if I select this option, if you follow the blue line across, you know that I've got this auto explode option. So the explode comment has now been selected. So what does that mean? That means we are now including narrow index terms in our search as well. So you can't see them right now, but if you click on the term itself, you'll see in a moment where proton pump inhibitors appears within the subject tree for CINAHL. So this comes under the anti-ulcer agents, which sits under gastrointestinal agents, which sits under the other term as well. And now you can see, of course, we do have examples of proton pump inhibitors, such as omeprazole, etc. So they're now included in the search. So by selecting Explode, we're going to include the narrow terms as well that relate to PPIs. Just to clarify also, you'll notice that this term, proton pump inhibitors, appears twice here. However, we're only going to have one instance selected. So the reason it appears twice is that there are different, obviously, subject trees in different categories, if you like, or classification. So it may appear in more than one area of the CINAHL subject terms. Okay, doesn't mean we're duplicating our results. It's just that that term features in other elements of the hierarchy for CINAHL. Okay. So once we've selected that, we can then run the search. And actually, let me go back to the term list because there's something else I need to include. So we are also, as we did earlier, going to include the original keyword search as well, and then combine the two. Now, sometimes you may wonder, why would you do the subject search alongside the keyword search? Well, the index search will obviously bring back content which has been indexed with those terms, whereas the keyword search is looking for the specific occurrence of that keyword search, again within the title, abstract, plus subject heading where appropriate. So if an item has not been fully indexed on CINAHL, or if it's what we call a pre-CINAHL record, so it's a new record and it has not been indexed, then at least using the keyword search, the free text terms, we are going to pick up additional records. Okay, so you might find some of the records may not have subject fields assigned. I mean, these ones do at the moment, as you see. If we change the sort, for example, these are the most recent. So I think most of these probably do, but occasionally you'll find records listed which only have the citation and the abstract, but no, not these subject fields that you see here. Now at the moment we've got the most recent records showing here, but we'll look at sorting it further on. So the first thing we're going to do, having completed these two elements, we're going to combine them using this option here to select all, and then search with AND. So basically we want all the results grouped together in one set. So we're looking at gastroesophageal reflux, or GERD, combined with PPIs. So now we've sorted them in, now we've kind of grouped them together in one set of results. Okay. Also to highlight here with the search history, you can see that they are ordered they're in the reverse chronological order. So if you want to sort them sequentially, just click search ID and hash, and that will bring back the search in that order. So you can see where we started from, condition we're looking at, and then the actual intervention, and combined together in the set below. So we have our results displayed there, and obviously we can narrow it down further. We might want to look at a specific age group, for example. So if we scroll down, you'll see we've got age and gender here. So we might want to look for, you know, the adults, say from 19 to 44, and then we can focus on those results here. Okay. And then gender also. So again, you can choose male, female here, whichever would be preferable. Now the age and gender, by the way, just to add, they are part of the indexing for CINAHL. So it's based on the indexing, so where those age groups have been assigned, you can see that with some of these records here. So for example, if we look at this one, see here, adult 1944, but if you scroll down further, you'll see this one also includes other age groups as well. So item 4 includes other age groups. Okay, and then also you'll see male, female where appropriate also. Okay, so these are part of the indexing for CINAHL. So it doesn't necessarily omit other age groups unless otherwise specified. So this one may be specifically this age group here. Okay, so we've got our results there displayed. Just to also remind you that geography, by the way, relates to country of publication and not the actual where the research was carried out, etc. Okay. So we have those results displayed, and also we can go in and view any of these. For example, you can see we've got the full text here for this particular item, so we can either go straight to the detailed record and save this as a review. Okay. Okay, so this one's about overuse of PPIs. So it is related to our search. And then with this, you can save to Google Drive, you can add it to the folder, print, you can email this reference as well from here. I believe we covered some of this in the previous session. You can save the record. So if you're looking to save this in Internet Explorer, it will save it as a text file. Okay, you can choose the citation formats and so on, or you can customize the field format. So you can click Save, and then this will store or be displayed on screen. So you could select all and cut and paste it into a Word document, or you can right-click and you can print and then save it as a PDF if you're using another browser like Chrome or Firefox or Safari, etc., as opposed to Internet Explorer. Okay, so a number of ways to process records here, and you have the site link as always, so you can see how to cite this particular item in the preferred reference style. And again, if you link on Harvard Referencing, you can get more information about how to cite various source types such as journal articles, magazine articles, book chapters, and so on. Now, we also include the export feature as well. So if you're looking to export and into a preferred software like EndNote, RefWorks, there's the export option here for this individual records, and you can choose the appropriate format once you'll need. So by default, this current account shows us RS format. So you can save or email in that particular format so that you can import it into the preferred software to add to your bibliography. So again, if you're advising a user who's doing this, then you can instruct them to use this particular tool. There is also the permalink as well. So the permalink will link you directly to this item. So if you want to share this item with a colleague or user, then this is the URL that you would use, not the browser URL. Okay, so this is the permalink. Likewise, if you were to go to the full text directly, if we go to the PDF here in this case, then again you could save email, site, etc. this particular item. Again, the site styles are given, styles, and again you can export a PDF directly from this menu. So if you're looking to create your bibliography, okay, and then the permalink this time will link you directly to the PDF that you see here. Okay, so again, use that instead of the browser URL. Okay. Now, of course, once you get to you have a series of results, then you may be, of course, looking to save these for future access, etc. Obviously, you could be saving. Let's go back to sort this most relevant, by the way. Okay, you could go through this list again and save individual records by clicking the Add to Folder icon. And when you do that, you'll see the third column pops up to indicate we've saved some items here. Obviously, if you want to look at the more detailed information for each record, just hover over the abstract here, and you can see, the magnifying glass, and you can see the abstract provided. If you want to view the abstract at the outset, just click on Detailed here and apply it, and then you can go through the list and then decide whether or not they are appropriate search results, or if you're working together with the user, obviously socially distanced at this time, then you can show that information, okay, by clicking the Add to Folder icon again and saving individual records. And of course, invariably, you may want to save the page results, click Share, and you can save results 1 to 50 at one time. So these are then stored in the folder. If you go to the folder, this may look familiar, and you have your results here that you can then process. You can still view them at this time, but they are, of course, stored here for the duration of the session. So from the folder, once you've saved a few records, you can print them, email them, save them, and you can, again, export from this folder. So the export option will once again give you the opportunity to forward RS format. So essentially, you can save these records, and then, of course, you can import them into your preferred software. If you ever get asked, or if there's ever the need, and I know this is certainly true in the academic sector, to obtain a spreadsheet of these records, there is the option to do this. You can download the CSV file, so click Save, and this will, in my case, open up Excel to display those records. So if a user does ask you for a spreadsheet or a list, a table of these records, then you can use that option to do so. Okay, that was a feature that was added a number of years ago in response to demands, primarily I think from the academic sector. So it has its uses there. But again, the default setting is to do a direct export at RAS format. So again, rather than using the folder, you can just use the export manager for that. Okay. So again, any questions on any of these features, any experiences you've had, or if you just simply want to clarify anything, please do let me know. Okay. So at this stage, obviously, you may be running further searches. You may not have time to complete this. You may need to come back to it. So invariably, you may want to save these records beyond the session. So you can sign in, of course. So click Sign In here, and as needed, and you may recall this, you can create a new account here if appropriate. Okay, and fill in the details as was shown previously. Okay, so you can click Sign In. Once you've signed in, of course, you can sign in with once you create your username and password, you can sign in. I'm going to go to sign in with Google just to save time here. And then our results would still be available in the folder, and this time they've been added to previously saved results. So I've not cleared it by folder out for a while, so I've got 155 records, even though I've only just saved 50. Okay, so the most recent records will be added toward the end of this list. You can see you can sort them alphabetically as well, by the way. But if I want to go to the previous records that I just looked at, I'd have to come to this page here, as you see. So toward the end of this list. Okay. So what this also means in terms of signing into your EBSCOhost folder is that you can also save the search, and you can also set up search alerts. So, but before we do that, we are going to look at creating a folder for, in fact, let's go back and save a search first, and then we'll look at creating a folder. So once you've run your search, you want to save it beyond this session, click Save Search Alerts. And again, it will prompt you to sign in if you've not already done so. At this stage, we can add other elements to the search. So for example, we've got our records here, but we may want English only. So go to Edit, and then you can see here we've got English only. Okay, and then you can click Search Save here. That means we can now factor this. In fact, what happened? Something happened there. Oh yes, yes, we've got it now here. Okay. We can now go in and give it a name. So we'll call it Gord API, and then we'll save it permanently or temporarily. So 24-hour period, I'll save this one and click Continue. So again, just as a refresher really of saving the search, which we covered briefly previously, and also to know when you have your Save Searches folder open, so you're directed to the Save Searches folder where this is now stored. And again, by default, they are listed in terms of date. So the most recently added searches are listed at the end of the pages. So if you scroll down, you'll see in a moment this item, Gord and PPI, which means I can now retrieve this or edit from here. Okay, so that's saving a search. Now, obviously, if we go back to our folder records, we may also want to create a folder to store our previously saved items in beyond this session. So if you look to the left-hand column, you'll see I've got two current custom folders. So by clicking New here, that first column, I can add my own custom folder. So I can add this search and the articles in this folder. So I can create this. So very similar to what you do with Outlook and other email programs where you want to keep records of emails for future access, to reference for time. And then you've got the folder here. So if we go back to the last page, for example, select these items, and I can copy or move them to that folder from here. Okay, in fact, I've copied everything else so inadvertently. But anyway, never mind. You can see here the articles are now stored here. Okay, So they're not deleted, they're just stored and away from the folder, which is probably ideal because if I run another search, for example, on CINAHL or go to Medline, when I save those records to the folder, they would appear in this window or the original articles folder under my folder. So again, anything you save automatically goes into the articles folder unless it's an image, video, ebook, for example, but other articles, etc., will be stored under articles. So we've saved them into this folder. We can also move our search. So if we go to Save Searches here and go back to the Save Search for this topic, we can also move this or copy into the folder. So I can also move this time, store it there. So basically what it means is if you're running a literature search, you can keep a copy of your search, the copy of your search results in that folder. Okay. There is one more thing, a couple more things you can do. So if we go back to our search results, you can also save a link to the search as well. So if you go to the results page and go to Share, let's go to these results here first. Just refresh the screen. So we did edit the search, if you recall, and then go to Share. You'll see there's a link here to add the search to the folder. So it says S1 and S2 because this is the final set that we're looking at. So click that link, and that will be stored in the folder as well. Okay, so if I go back to my folder, and then on the left-hand column, you'll see we've got this reference to persistent links to searches. So 3 links are saved from previous searches, and this is the most recent one related to our topic today. So I can select this, and I can copy it or move it to that folder. So again, I'm grouping everything together in one folder. So maybe a departmental folder that you create. It could be named individual, clinician, nursing practitioner, occupational therapist, who you're working for, supporting with literature searches. So again, you can use your imagination how you use these folders, how you label them. You can edit the folder, by the way, as well. So if you change your mind in terms of the searched folder, do that. You can also make it a subfolder of existing folders as well. Again, you can add a description just to clarify maybe who this is for, etc. And then you can, so you can move, also select this and move to that folder. So we stored there, so we don't need to do that again. So that's important to note because there are a couple of things that you can share from this folder with other recipients. So typically you may, of course, once you've run a search, you may be looking at, saving and then sharing results with users in response to, for example, their literature search request. You can also save items to the folder and share those items with a user. So basically what you need to do is go to the folder and click Share. Okay, so you then add the email address of the recipients who you want to share this information with. Okay, and also use a semicolon if you're going to send it to one person. So it could be that a group of nurses, for example, they're working together on a particular project, they're covering a particular topic, and they may nominate one person to be the contact point, the named person to store this information, but then they can invite the others to access that information. So what they can do, each can have their own EBSCOhost account, my EBSCOhost account, but you would then invite them and they would access that folder. So essentially, any recipient here will be sent a passcode. So once they receive that passcode, they will then go into their own my EBSCOhost account and then go to the left and see the folder that's been shared with them. Click Add, bottom left, and they will add the passcode to gain access. So access is read-only, and essentially you have access to the articles that are saved on a read-only basis. You cannot add or remove, but you can view them. And you can also view the persistent link to the search as well. So you can obviously take that and cut and paste that to the browser to rerun it yourself. You cannot see the saved search, and you cannot see the search alerts, which we'll look at in a moment. So the two things that you can share directly from the folder, in other words, inviting others to access it, are the articles themselves and a persistent link to the searches, but it's on a read-only basis. But obviously, over time, if you add more articles, then they can go back to that folder and see that information. Okay. So any questions on that, please send them through to me. Okay. And again, you can see here we've got the article stored, a link to the search, and the save search also. So the next element that I want to look at is the search alert itself. So obviously, you can save a search as we've seen. If you go back, if you recall, you can also print the search history from the search history page. But we also now need to look at running a search alert. So having the search rerun in the background periodically to bring back the appropriate resources. So I'm just going to go back to my search page. Just going to check if there's any questions that have come up yet. So we go to our search history. And again, you need to be signed in for this. So we can go to say search alerts. And this time we've got the alert option. So we can choose that radio button. Now at this stage, you can still edit the search as well, by the way. So again, before you save this, if you're satisfied with that, again, you can give it a name. You can add the description, but it's not essential. The database, of course, is pre-selected. And we're looking at the current search. And it's choosing the frequency. So do you want it daily? So if you set this up for a user, would they be satisfied, or do they need daily alerts on this topic? Obviously, at the start of the pandemic, over a year ago, almost over a year ago now, I'm sure many would have liked to have daily alerts to be informed as quickly as possible about what's out there, what's going on. You can have once a week, twice a week, or monthly. Then, how far back do you want the search results to be generated for? In other words, articles published for the last month, 2 months, 6 months, no limit. Obviously, if you go to 1 year or no limit, you're going to retrieve records that have already been previously acknowledged, etc., by the recipient. So you may want to set this for the last 1 or 2 months. And then you can run it for up to 1 year or a minimum of 1 month. So prior to the expiry date, it will prompt the recipient or yourself, if you set this up for them, to renew this or otherwise. So if you want it for a year, more than a year, prior to the end of that year, you can extend it for another year. Then you can choose the format. What are the results that you want them in? Do you just want the brief citation? Would you like to receive the abstract for each record retrieved? Are you looking to export them into EndNote or Reference Manager? Then choose Big Reference Manager. Then add the recipient's address. So again, it could be more than one person. And also note, if you send this out, for example, as a kind of current awareness tool to groups of healthcare staff, you can hide the addresses from recipients. So you can essentially BCC directly from the interface here. And then you can go to add the title or subject, change the alert notification if you wish. The email address, just bear in mind, this is the default address. If you're using a local account, it may be slightly different, or regional account. Nationally, I think it's still epalerts@ebsco.com for NHS in England, but you can override this. So again, bear that in mind. If people are not receiving emails, maybe the EP Alerts email address is getting blocked or something, then you can override this. But then once you've done that, you can save, and this will confirm the alert has been created. So you can see here, we have the alert name, the database we're on. It's going to run for 1 month. It's going to provide links every 2 weeks. And this is the search strategy, which is very obviously basic, just 2 sets combined. They are restricted to English only. And we have the RSS feed. So if you click continue, that's there, and it's in the folder on the top right. So if we go to the left, then you'll see this column again, and you'll see we've got the search alert saved here. And again, confirmation about the frequency and also who it's going to. You can edit this as well as needed. So if you have other recipients you want to add, or you need to update the email addresses, then you can do so. If you want to extend this, do so here as well and click save. So again, it's possible to, review the search alert, make updates to it. And also, as before, if you select it, you can move it to the original folder or the new folder that you want to store it in. So again, alongside the articles linked to search, save searches, you have the search alert also nicely in one folder. Okay, so again, that's stored there. Now, one thing to bear in mind, of course, for look at publications alerts is that if you have set this up for a user, it's not for yourself as part of a literature search, but you set it up for a user for example, physio, occupational therapist, nurse, practitioner, etc., then you may want to remove this. If they no longer require this, or if they leave your organization, leave your trust, then you can go to the search alerts and then you can simply delete from here. Okay. Okay, so just bear that in mind. If you set up alerts, then you need to be responsible for managing that, as it were, and also advise them if you are educating them to use that feature as well. So there is the option also of being alerted to new publications or new content publications. Go to the publications alert on the toolbar. Again, this is all about informing your users of keeping current with the literature, and you can run a search. For example, if we go for journal nursing here, then you can choose the appropriate link. You can browse the issues, of course, here, or go to share, and then you can email alert here. And again, as with the safe searching, the search alerts, you need to be signed in here to EBSCOhost. You can then again enter email address for who they should go to. Okay. So remember, this is to inform users, recipients of the latest content of a given journal. You can also choose the formatting, HTML plain text, the results format. So again, you may want to include the abstract for the records retrieved or identified as new content for this issue, and click Save the Alert. And unfortunately, it's just timing out there. And I think if I go to Folder, it would still be there. So it's there. Okay, so I have created this, and this will be running into the database for CINAHL. So again, you could go back to the journals, look at other publications, look at other journals that you feel will be of interest. You can set them up for different individuals or the same person, and of course also you can train them on this, remind them how to set up an alert as well, this particular feature. Okay. Okay, so I'm going to stop there. Okay, and see if there are any questions before you look at any of the help materials. So I'll just pause here momentarily and see if there are any questions. So stop it, pause here momentarily for any questions.